In family medicine, preventative care is one of the areas that we really love to focus on the most because it's helping to prevent disease before it even happens. And the young adult population is probably one of the best populations really to target when it comes to preventative medicine. That group of individuals is really typically young and healthy, and they haven't develop some of these diseases that we see kind of when we reach middle adulthood and older age. So when we think about preventive medicine, we really like to start young because that's when we can do the most good for our patients. What specific preventive care services and screenings that we do, it really depends on each unique patient population. It depends on patient sex, patient age, and that sort of thing. So we really target it to screen for some of the diseases that are most prevalent amongst different age groups. So one that we start screening for, as young as adolescence and then into adulthood as well, is depression, because that is so prevalent in our society today, and we want to make sure that we're caring for the entire person, which includes their mental health. So every year we recommend just a screening for depression. Another screening that we recommend, especially in young adult females, when you hit the age of 21, is we start thinking about cervical cancer screening, because that's another disease that we found if we screen with routine pap exams starting at age 21, that we have been able to really decrease the prevalence of cervical cancer. Another one that we screen for, especially in young adults, is we screen for lipids. And so we look at your cholesterol and we see, do you have a high risk for developing high cholesterol? How can we intervene? Whether that's with diet or exercise, not necessarily medications when you're so young, but we like to know if you're at risk, because that's going to change your risk for heart attack and stroke as you get older. We would definitely recommend talking with your primary care physician if you have questions about any preventive care screenings. That's really, like I said, in primary care, it's one of the things that we love to do and we focus on. It's kind of preventing disease. So we are pretty well versed in what specific recommendations are recommended for each individual in each age group. And if there's something that comes up that you're interested or you're just not sure, definitely ask your primary care provider. There is a commonly held belief amongst people, especially when they're younger, that, I'm healthy, I couldn't have some of these diseases and I don't need to be screened, or it wouldn't happen to me type of mentality. I think another factor is that sometimes we just don't know. We have young, busy lives as young adults, myself included, and we don't think about it because we're feeling well, and we think, as long as I'm feeling well, there's no need to go to see a doctor. But it's really that keeping you feeling well is why we want you to come see a primary care provider. When people come see me and they're a little bit hesitant about doing preventative care routine screenings, my first step is just to kind of understand why their hesitation exists. Maybe they've had a bad experience in the past, or maybe they have, family history of a certain disease and they're nervous to get a test that might show that they have some sort of underlying disease process going on as well. So I always try to just ask the patient first. My goal, again, is really to just help everyone lead as healthy of a life as they can, and to help them, grow into their adult lives wherever that may take them. I just encourage young adults especially, it's a busy time when you might be moving in between going to college and settling down in different areas and things like that. So don't be afraid to take the time you need to really find a primary care provider who you feel like you gel well with and can create that relationship with, because you're going to be able to carry that for years into the future. And so it can always be uncomfortable to meet new people at first and have to kind of share some of your past history, but once you do, it will pay off dividends in the future.